is Erica Turlack, and I'm a sports medicine and fitness technology student at Kaiser University. I'm currently taking advanced care and prevention of athletic injuries, and today I'm going to be talking to you about ACL injuries, what they are, how to prevent them, and what to do in order to get back into sport after tearing it. So what actually is an ACL tear? An ACL injury is a tear or sprain in the anterior cruciate ligament, which is one of the most important ligaments in your knee. The purpose of the ACL prevents interior or forward movement of the tibia off the femur. It also prevents hyperextension of the knee. ACL injuries are one of the most common knee injuries among athletes, and according to the American Orthopedic Society of Sports Medicine, about 150,000 ACL injuries occur in the United States every year. It is also stated that by the same source that ACL injuries account for more than 500 million U.S. healthcare costs every year. Athletes who participate in high-intensity sports are most likely to have this injury. According to the American Academy of Orthopedic Surgeons, it is said that around 70% of ACL injuries occur through mechanisms such as pivoting, cutting, sidestepping, out-of-control play, or awkward landings. The other 30% of ACL injuries occur from direct contact with other players. It is common for high-intensity sports such as football to have a high rate of ACL injuries. However, it is more common for women to have higher risk of ACL tears. According to NIH Medicine Plus, women are 2 to 8 times more likely than young males to injure their ACLs. It is the most common injury among female soccer and basketball players. The ACL is one of 2 ligaments that cross the middle of the knee. These ligaments connect your femur to your tibia and help stabilize the knee joint. Without ligaments to stabilize the knee, the joint would be unstable and become prone to dislocation. The main job of the ACL is to prevent forward motion of the knee and to prevent the tibia from sliding too far forward. If an athlete does not have this ligament fixed, it will cause problems for them when it comes to pivoting and cutting. It will also increase dislocation of the knee in that athlete. Some examples of how this injury can occur are if you twist your knee while keeping your foot planted on the ground, stopping suddenly while running, suddenly shifting weight from one foot to another, jumping and landing on an extended knee, and experiencing a direct hit to the knee. Some signs of this injury include hearing a loud pop or feeling a popping sensation in the knee, severe pain and inability to continue activity, rapid swelling, loss of range of motion, a feeling of instability or giving way with any weight bearing, instant bruising to the knee, and pain while standing, and some limping may occur. The most common test athletic trainers and doctors can use is called the Latchman's test. The Latchman's test is performed to evaluate abnormal forward movement of the tibia by pulling the tibia forward until they apply a tug. This movement should produce a firm endpoint. If the endpoint is not firm, or if there is an increased interior translation of the tibia, it can then be conducted that the ACL is ruptured.
Flex the knee to 20 to 30 degrees. Encourage the patient to relax their hamstring musculature. Firmly grasp the femur with one hand, and with the other hand behind the proximal tibia. Firmly pull, displacing the tibia upon the femur, looking for the amount of anterior displacement and the firmness of the endpoint. It's always nice to compare it to the opposite knee, and if you get increased displacement or a soft endpoint, this usually indicates an ACL injury.
You can also perform a physical exam on the knee to determine if the ACL is ruptured or not. These tests include inspection, palpation, and assessment of the knee joint function. When it comes to an ACL tear, the most common form of treatment is surgery. Only about 1/3 of people with a completely torn ACL are able to build their muscle strength enough to resume normal activity without surgery. Continuing on without surgery may be an option for those who are inactive and if the injury is unlikely to interfere with their daily life activities. This strengthening process will take 6 to 10 months to complete. Active individuals, especially those who are young, or for those who are athletes, are more likely to opt for surgery so that the knee can be repaired and the athlete can return to sport. Other treatments prior to surgery include RICE, which stands for rest, ice, compression, and elevation of the knee. The athlete should be on crutches until their surgery date, since bearing weight on this limb is not recommended. It is very important that the athlete does these things in order to keep swelling down and to keep the knee stable before they can see a doctor. Before an ACL surgery, it is important to schedule both pre- and post-therapy sessions. These sessions will include a pre-operative evaluation, which will test the athlete's physical limits and teach the athlete exercise to do before surgery. After surgery, it is important to keep up with the exercises daily so you do not lose any knee motion or strength. According to UPMC Health, it is stated that from the time the athlete undergoes surgery to when they are fully recovered, it is about 6 months or more recovery process. It is very important for the athlete to stay on rehabilitation programs to keep them on track and to have the athlete continue to gain muscle at a slow rate. Around week 2 through 4, the athlete will be able to start bearing weight on the knee, and physical therapy sessions will begin on a weekly basis. When the athlete reaches month 2 through 6, it is important for the athlete to be involved in programs that help regain strength and stability. Specifically, at the 5th month, the athlete will be able to start a light jog. During this time, the athlete will also start injury-specific programs and sports-specific programs. It is important for the athlete to take it slow during the recovery process. The knee needs time to heal, and the athlete needs to not rush this process or to rush themselves too fast or too soon, as this can possibly re-injure the area. Research by G. Mickelbust and R. Barr states that athletes who want to return to pivoting sports, that returning to play is advised after 4 to 8 weeks when full range of motion is established and there is no joint swelling present. The entire purpose of an ACL reconstruction is to give the athlete a mechanically stable knee and to reduce the risk of injury to the menisci and cartilage by reducing anterior-posterior joint motion. It is also recommended that the athlete goes through a series of tests to determine if they are ready or not to return to play. According to Mike Reynolds, there are 3 tests frequently used for ACL testing. Those 3 tests are isokinetic testing, handheld isometric strength testing, and the hop test. The main goal of these 3 tests are to determine if the athlete is strong enough to return to sport with a reduced risk of re-injuring themselves. The most popular and most used test out of the 3 tests is the hop test. Research from Ronald Thomey and Suzanne Werner confirmed the importance of performing hop tests during both non-fatigued and fatigued conditions. The side-to-side difference between the legs were higher during the fatigue conditions, indicating a need for a more demanding test to determine where the athlete is at. These tests are put into place to determine the progress of the athlete in order to dramatically decrease the re-injured rate in the athletes.
3 tests at this stage. These are usually performed at 24 to 30 weeks. So now we're starting to get into that 6 and 7 month time frame with our ACL patients when we're really trying to determine, are they ready to get back on the field. So we're going to demonstrate, once again, the single leg hop for distance, a triple hop for distance, and a crossover hop for distance. These are all unilateral limb tests, and we're always comparing her operative leg against her non-operative leg, and we're looking to see if she can cover at least 90% distance compared to her stronger side. So we're going to demonstrate the single leg hop test again. Once again, you could do some practice trials. The first jump is a medium effort. Good. And then the second jump, 3/4 effort. Good. And then she's really going to try to nail the good jump, max effort, boom. She'd stick that landing, we would mark it, and then we could just measure with a tape measure to the nearest centimeter. Okay? And then her operative leg goes second with 50% effort. For the sake of time, we'll just go right into the max effort, and she would jump. We'd measure that distance, and we'd calculate the limb symmetry, make sure she's jumping at least 90% compared to her stronger leg. That's the single leg hop for distance. The triple hop for distance is 3 hops in a row, and the last hop has to be maintained for 2 seconds. Once again, we don't want to see the other foot touch the ground. We don't want to see her lose balance. So 3 consecutive hops in a row. 1, 2, 3. We could put a marker down and we'd measure that to the nearest centimeter. And then good leg always goes first. The weaker leg always goes second. 3 hops in a row. 1, 2, 3. Stick that landing. Put a little marker down. And then we could measure with a tape measure. And she's got to cover at least 90% compared to her other leg.
When it comes to bracing an athlete post-ACL surgery, there are pros and cons to how you look at it. The pros to wearing and bracing the athlete includes a form of stability for the athlete as they return to sport. Bracing the athlete and forming that sense of protection will also make them not second-guess their movements during play. Using a brace during play can also be used as a way to prevent future injuries. Either an athlete wears a brace in order to prevent reoccurring injuries or to prevent possible future injuries. It is very common for football players to wear braces just for protection. Now, on the other hand, the cons to wearing a brace are that the athlete wearing the brace may become a target for other players on the field. It is very common, especially in soccer, for this to happen. Braces also tend to lead to restriction of the athlete. Since the brace is made to stabilize the knee, it does not let the athlete fully extend their leg while running, which can become a major issue for some athletes. Wearing a brace can also have a negative mental side effects on the athlete. I know this from personal experience that sometimes if the athlete heavily relies on their brace to perform well, it will make them unsure about their movements when the brace is not present. Being unsure or hesitant during play can increase re-injury tremendously. Apply it on the athlete by unstrapping the straps, having the athlete place their leg into the knee brace, and adjusting to make the pads on either side of the knee. You first take this bottom strap right here to almost like stabilize the knee brace. Then you take this top one, you wrap it around the back, and you tighten it back there as well. You then want to take the middle strap right here, this front one, and then the back one. The main point of this brace is to restrict inversion of the knee and to prevent possible re-injury from pivoting or changing direction while the athlete is in play. When it comes to prevention of injury, building strength in the muscles surround the knee is the most important part to this entire recovery process. The more the athlete builds muscle and continues to increase their muscle mass, the lower the risk will be for re-injury. The more muscle the athlete has, the less likely they will be prone to inverting their knee while they run. There are certain testing and programs recommended in order to achieve the strengthening goal. Research done by Bobby S. Ershmer, Chad Harris, Ronald P. Perfer, Mark de Blasio, Kent Adams, and Kevin Shea dives into jumping techniques and the importance of adding this technique into the athlete's training programs. It is important that when getting back into your sport that the athlete focuses on all areas to prevent re-injury. Improving landing control can be achieved through modifications of enhanced body control and joint stabilization. They state that although jumping techniques are taught in athletic practice, the landing aspect, however, are neglected. You all, and have a great day.